Hi, I'm Dom. I am the Vice President of the Student Vets Organization here at Finger Lakes Community College. There are a lot of professionals working in mental health, counselors, psychologists, social workers, and others. My friend Zach and I had an opportunity to talk about these roles these professionals play in mental health with Hennessy Lustica. She is the Community Schools Mental Health Director at Seneca Falls Central School and a professor at Medaille University. It was a really good conversation. Hey Hennessy, thank you for coming out. Today we're going to talk about who the players are in mental health. Before we get into that, can you tell us a little bit about yourself?
Sure. So I was a school counselor for 17 years. Most of that was in middle school. I also have some experience in elementary and in high school. I'm licensed as a mental health counselor in New York State. So I had a private practice where I see kids and families. I'm also a professor in the clinical mental health program at Medaille University and the Community Schools Mental Health Director at the Seneca Falls Central School District.
Oh, wow.
Lots of things.
Yeah. So I guess I'll start this off with what is a counselor?
Yeah. So a counselor is somebody that is licensed or credentialed in New York State to provide support or treatment or help for anything around mental health. And so there are different kinds of counselors. There's psychologists, there's counselors, there's school counselors, there's mental health counselors, and each of those have a different kind of educational path to get there and a different credentialing according to New York State.
Gotcha. What kind of education do they have for each category, I guess?
Yeah, so master's level. Mm-hmm. So they're all master's level. So you can get a master's in social work, you can get a master's in school psychology, you can get a master's in school counseling, you can get a master's in mental health counseling. I have a doctorate in counseling, education, and supervision on top of that as well. But anybody that is providing counseling or providing therapy, either in the school or in a private practice, will have a master's degree at the very least.
Gotcha. Mm-hmm. As far as your role goes as a counselor, what is your role in maintaining or bettering mental health, in the schools and stuff?
Yeah, so mental health is super prevalent now. I think it was always prevalent, but COVID has kind of shined a big light on that. So every school has a mental health team or a behavioral health team, and that's made up of school counselors, school psychologists, school social workers. A lot of times there's licensed mental health counselors that come in from outside agencies that help as well. So depending on what you are, your role looks a little different. So if you're a school counselor, you're really focusing on three kind of buckets of work. So academic, personal, social, and career and college development. And you're doing both prevention and intervention and responsive services around that. So you might be, going in and doing classroom presentations for kids around careers, or you might be meeting with kids in a group who are struggling with anxiety, or you might be working with kids who are failing their classes. There's a whole kind of range of things that you can do as a school counselor. As a school psychologist, you can do a lot of counseling as well. I'm not a school psychologist, but school psychology training is really around assessments as well. So educational testing, a lot with special education, working with kids again, pre-K through 12, but really they're the experts in the building around the educational testing and interventions, response to intervention, that type of thing. And then school social workers, again, they have a master's degree. They do a lot of their work in counseling, so they're able to do that direct counseling. They also work a lot with systems, so helping kids and families kind of navigate the education system or the legal system or any sort of system that you can think of, a social worker would work with. A licensed mental health counselor is able to, under New York State, able to assess and then evaluate and then provide treatment for a mental health disorder. So anxiety or depression or PTSD, whatever. The licensed mental health counselor, that license allows them to provide treatment to that individual.
Gotcha. In your experience, is it common to have all of those different positions in schools? In my experience, I just feel like I haven't, growing up myself in high school and middle school and stuff, I feel like I haven't gotten those resources before. Is it just more common now, or?
Yeah, so I think it's changed. Well, I know it's changed, especially in the school counseling world. You think back to like when older folks think back to they had their guidance counselor, and that has changed. The field has definitely evolved to be more a school counselor, where you're looking at the whole child and you're looking at, again, academic, career, social, emotional kind of stuff. But according to state ed, every school has to have a school counselor, has to have a school psychologist. School social workers are not mandated, but it is best practice to have a school social worker or 2 or 3 in the school at this point. But the behavioral health team is there.
Wow. I mean, I haven't experienced that growing up, but I'm glad that it is now more mandatory because I think it is very beneficial.
So specifically with those social workers, what do they bring to the table that the other 2 or 3 don't?
The social workers?
Yes.
So I'm not a social worker, but I can tell you what I've learned from the social workers. Really a clinical lens that's so strong around diagnosis, or so strong around certain disorders, so anxiety, depression, PTSD, all of those kinds of things. A really great understanding of the resources in our community and how to link with those resources in our community. We cannot operate in a vacuum in schools, and we need the community to help, especially in our rural districts where there's not a lot of providers. So social workers bring that to the table. They're really skilled in working with families. They're really skilled in working, across the whole socioeconomic spectrum of folks, and then basic needs stuff, right? So social workers are really skilled in like, does this family have food? Does this family have housing? How can we get these supports for them? And we should be a team. That's it. We just need to be a team.
So they handle those fundamental pieces, whereas the other ones can target issues specifically within the life and the mental state of the student or client.
Social workers can too. I mean, clinically, they're very, very skilled. Everybody's doing counseling.
Oh, okay. I
Yeah.
see. I just imagine it like the social worker ensures that they can take away or help reduce stresses like food insecurity and housing, whereas the other parts of the team can focus on mental processes and cognition.
I think one has just more outside resources open to them to help with that compared to some of the others.
I see. Okay.
Yeah, from their training.
Yeah.
From their master's degree training. Yeah. But we're all counseling kids together.
Right. That same common goal.
Yeah.
It's all just a teamwork, team effort.
Yeah.
So how do I know who I should go to if I feel like my life kind of isn't going right?
Yeah. As a kid or as an adult?
I guess just answering like both, I guess.
Okay. So as a kid, talk to your parents, of course. You always, hopefully kids are talking to their parents. Talk to your friends, who's your support system around you. And then luckily you're built into a support system every single day in a school. So your safe person or your trusting person doesn't have to be a counselor in that school. It can be a lunch aide. It can be a librarian. It could be whoever, right? It could be your teacher. Those folks are trained to reach out to the counselors for help around that. But, if you have a safe person in your life, just talk to that safe person. They don't necessarily have to be a counselor for a kid. And then that safe person can help you get to the help that you need.
What do I do if I'm not sure if I should see a counselor, a social worker, or a psychiatrist? Or,
It's a lot. So a psychiatrist can prescribe meds. The rest of us cannot prescribe medication. You've got a psychologist. There's a whole gamut of people that you can see. It's going to depend on your insurance, right? Who's going to take your insurance? It's going to depend on who's available in your area. But it's really about the fit with the person. Like when you get into therapy or into counseling, you want to be able to have a good relationship with that person. You want to be able to be yourself with that person. And if you're not, ethically, it's the counselor's job to say, okay, let's find somebody together that is a good fit for you, because this is all about you. So sometimes that title matters less than really the relationship that you have with that person, if that makes sense.
Gotcha.
Right. So one thing I was wondering about, and you said that inside the schools, there can be other people that can help provide cues and pieces
Sure.
to the, what did you call it, the mental health team?
Yeah.
So do you see students bring other students in as well? You said a trusted person doesn't have to be an adult per se. Do you see that as well?
Constantly, every single day. Kids
Right.
bring other kids in, especially during lunchtime. That's when kids like to come down a lot.
Sure.
Or during math class, because they want to get out of math class. But Yeah, they bring kids down all the time, and we welcome that. You know, the more kids that we can impact, the more skills that we can teach, the bigger a kid's support system, the better their outcomes are going to be.
Right. Now that's funny because I think that old adage, kids can be so cruel. Mm-hmm. You know, we imagine high school, middle school age, students can be very, they can be pretty mean. You know, it's that time of your life where
it's gross.
Yeah, but it sounds like you see a lot of that help. Mm-hmm. Do you think there's more empathy among school students than some people might think that there is?
Yeah, I think that there is. No kid wants to be hurt, and hurt people, right? Yeah. So, and sometimes the externalizing behaviors that we see, the anger that we see, that's about control, right? So the example I always give kids is if you're walking through the cafeteria and you trip and you fall and your tray goes all over the place and kids are laughing at you, how do you feel?
Embarrassed,
yeah. Right? That's gross. Nobody wants to feel embarrassed. So what do? You stand up and you slam your tray down, or you kick a chair, because you need to be back into control. So that anger sometimes can really be a mask for that feeling that's happening down, those gross feelings that we call them. So if we can at an early age teach kids feeling vocabulary, what feelings feel like in your body, coping strategies, all of those types of things, and then start to build in empathy and learn from each other, because if you know each other's stories, you're less likely to do harm to one another. So yeah, kids can be cruel. Middle school kids can be, bullies and that kind of stuff, but everybody has a story, and everybody is reacting in that way, I think, because of some other feeling that's going on that they don't want to feel, right? Yeah.
So I know for counselors, they do some life coaching and stuff. What does life coaching play into mental health? How does that play into that?
Yeah, so I don't know a ton about life coaching, but I know they're two different things. So I know for a mental health counselor, you have to go to an accredited program, you have to get a master's degree, you have to sit for an exam, and you have to be licensed by New York State. Right? And that's how it is for school counselors, school psychs, school social workers. There's all of these kind of safeguards put into place. Life coaching, I don't know if it's a program. I don't know how folks become life coaches, but they're not licensed. It's not like a licensable thing in the state, so it's not. I don't know. It's not licensable, I guess.
Gotcha. It's just really interesting because I feel like that's kind of how it was back in 2000. When I was in high school and middle school, and your guidance counselor, that's what I felt basically it was like a life coach, not somebody to.
They were trained different.
Yeah.
Yeah, the training was different, and there's nothing wrong with a life coach. If you find that person that you can connect with, 100% connect with that person. If you're looking for something specific around a mental health disorder, I would say and a life coach would tell you that that's not their area of expertise, right? You need a higher level of care.
Gotcha.
Yeah.
I like to really think about things in terms of the fundamental basics, I think that a lot of people tend to overthink, especially when you're looking for something. We think about all the possibilities and outcomes that could result. But the message that I'm seeing to understand here is that it doesn't matter so much who you see first,
right? Because
they know who to direct you to.
100%.
I think the biggest part is that first step that you take to get to where you need to be, and then it seems that there's a similar base level of training for these people, and then they can direct you to a different person if that's what needs to happen.
Yeah, and there's a network, in the Rochester, Syracuse area, around here, around any city, anywhere, there's a network. We know each other, and we know what each other's areas of expertise are, and we're able to refer out to get the best care for our clients.
So not to split hairs, but I think we've been using the terms counseling and therapy interchangeably. Is there any real difference between the two, or are they basically the same thing?
For me, it's semantics. It's basically the same thing. We're called therapists, we're called counselors, we're called clinicians. Sometimes our patients are called patients, sometimes they're called clients, but it's basically the same.
Okay, so it's all just one term. Nothing really matters between the two. Okay, I just wanted to clarify that real quick between all this conversation we've had so far.
Sure.
Yeah. Gotcha. I know a lot of parents get very upset when someone tells them, "Oh, I think your child might have something wrong with them." Have you ever experienced
Yeah.
anything like that? And, how bad, kind of was it for you in that situation?
Yeah, I mean, I'm a mom too. Nobody wants something wrong with their kid. That's like the biggest, scariest thing ever. So, especially in the school, sometimes the school counselor can be the first phone call that a parent can make, and they can be, they can be yelling or whatever. That's fear. You don't want something wrong with your kid. So using the same skills that you have as a counselor to de-escalate a kid, you can use those skills to de-escalate a parent as well. And really just, providing a safe space for them to vent and talk to you, and giving them empathy. I always connect with folks as a parent myself. It's terrifying. Something's wrong with your kid and you're telling them this information. Get a second opinion, get a third opinion. Let's bring a team in to figure this out. I've only had folks be very grateful, I will say. Sometimes the label can be helpful, again, to get you into the services that you need. As a private practitioner, I didn't take insurance, so I did not have to diagnose either. So it was a little bit different for me with kids. But I think it's just having that safe space and having that relationship and talking them through it and being really empathic and understanding and letting them feel whatever they want to feel.
Yeah.
It's their kid.
Yeah.
It's scary.
Yeah.
Who is their point of contact when they're trying to reach out and get answers and everything at the school?
Yeah, so it depends on what the issue is. Academic, always go to the teacher first. The counselor does not have the information that the teacher has, and the counselor's just going to go back to the teacher. Each kid, like I said, is required to have a school counselor. So at the beginning of the year, you should get a letter from the school saying, I'm Dr. Luska, I am your daughter's school counselor. Please reach out with anything. And it's usually like an alphabet, like an alpha split.
Yeah.
So the school counselor is usually the first line that the parent can reach out to, for sure.
Gotcha.
It also depends on who they have the relationship with.
That makes sense.
Yeah.
Right. And I think, you hit a really good point there talking about the parent piece. When I was younger, this was probably 10, 15 years ago, I think there was a period of time where people felt that doctors were pushing a lot of medications for children with those quick diagnoses.
Yeah.
The school was convinced that I had ADHD, when I was in grade school. And after rounds with psychiatrists and counselors to talk about this and do that testing that you had talked about, they found it was more to do with the curricula structure of the school. I was getting bored in the classroom. So I was doing other things and fooling around because I'd finished my work so quickly. So there's that fine line, I feel like you have to walk, to work with parents and listen to their intuition. Do you have any, advice or some guidelines for teachers or interfacing with parents to help them, work through these things?
Yeah, it's out of our scope of practice to diagnose. So, educators should never be saying your kid has ADHD. That's a medical diagnosis. What instead should be said is what they're observing. So I am observing Zach get out of his seat. I am observing Zach put his head down during class. I am observing Zach didn't do his homework, right? That's what's happening, and that's what the teacher is observing. Same thing when the school counselor talks to the parent. They're never going to say, oh, I think Zach has ADHD, right? Out of our scope of practice. This is what we're observing in the classroom. This is what we've observed in the cafeteria, and we just like to have a bigger conversation about it.
Right. So there's a lot of patience involved, and also, finding that middle ground. You mentioned the empathy with the parents because you're a parent yourself.
Yeah.
I also get this general sense with what we've talked about today with mental health, especially with younger individuals. It takes a village.
Yeah.
It's not only adults that are in the loop, but you said it's lunch monitors and teachers and aides that all see these things and they talk to the mental health team, but it's also peers at their level. Is that an overarching theme in mental health treatment overall, having that support network,
Yeah, for sure. When I teach, we talk about risk and protective factors, like global risk and protective factors for folks. So like protective factors would be the community that's around you. So it would be like, the religious organization you're a part of, any social organizations you're a part of. How's your family structure? Are you employed? Do you like your job? Like those big kind of risk factors or protective factors. And then the risk factors would be isolation. or, substance abuse, or just like being by yourself. So I think it definitely takes a village to raise a kid. I also think it takes a village to be a grown-up.
Yeah. I agree with that. I am curious though, if there was one thing that you think you could change for the better about, I guess, in all of mental health in the schools, what would be one thing that you would suggest?
We need to work as a team, collaboration, teaching collaboration at the master's level when these folks are in training, what that looks like in best practice, stopping with the territorial stuff. We need to work together for kids and families. We need, we each bring strengths to the table. We need to have a strength-based approach. We need to have open conversations about what's going on and really think about how we can help these families. And we need to do it together. That's the biggest thing that needs to change.
Gotcha.
That reminds me about, one of my family members is a lifelong nurse. And she was the era where they just started to train nurses and doctors side by side.
Yeah.
For years it was very segregated in the medical field. The doctors trained as doctors and the nurses as nurses. And they didn't meet until it was in a facility.
Yeah.
But then they started to change how that worked, get them out there so they can learn the language, they can work together as a team, But what about leveling the playing field, maybe parent to student or even adult to their child, to get on the same page with mental health? Is there anything that would help broach that topic?
I think it's all about education and transparency and, normalizing. We all have mental health. We all have mental health. Just like we have physical health, we have mental health as well. Everybody has it. Everybody has feelings, right? Everybody does not have the skills to talk about those feelings. So how do we educate that it's okay? That, how do we get the shame away from it, the stigma away from it, and really showing people where the resources are, right? And making sure that we're introducing, get people's faces out there. Counselors, we're sitting in an office behind a door, open the door, you know what I mean? Get everybody's faces out there, introduce, have meet and greets. Everything doesn't have to be super clinical and super crisis oriented in the moment. So what can we do up front preventatively, and what can we put in place to show that we're people, you're people, we're just talking, right? I say that to kids all the time. We're not changing anything. We're just talking. And so making sure that parents know that and that kids know that, I think, is really important.
Wow. Well, Hennessy, this has been really great. I think we covered a lot of ground and it was very informative. We appreciate you for coming out.
Thank you. It was so nice to meet you guys, and I was happy to be here to do this.
Of course, thank you so much. And again, thank you for the work that you do. You provide a great service for a lot of people, and that's very important right now as the world goes, So thank you.
Awesome. Hopefully this helps one more person reach out to a counselor.
Our conversation with Hennessy gave us a better understanding of the various professionals involved in mental health care. Keep watching for a list of resources that will help you learn more about mental health services in your community, and look for opportunities to have your own conversations on mental health.